Dr. Choll Kim here from sunny San Diego, California. We are getting started. Everyone's working very hard to get everything set up. The smaller the incision, the more equipment. It's amazing how much teamwork is required to make all this happen, because we have a very healthy, very active 50-year-old. He's a contractor, owns his own construction company. He's got a wonderful wife, 5 kids and 3 dogs, and he's miserable. Can't play basketball, among other things, because of this. He's got a disc protrusion at 2-3, causing right neuroforaminal stenosis and a lateral recess stenosis, irritating the nerve. He's got what looks like a small disc herniation, but it's exactly in the wrong spot, pushing across the traversing nerve root. That's L5 and S1. That's probably S1. You can see how it's shifted forward. L5 you can't even see anymore on that right side. And he's got degenerative scoliosis. He's had the degenerative scoliosis for a long time, so his sudden increase in pain is due to an acute disc herniation, and all the rest we can treat non-operatively as long as we can free up those 2 nerves. And he's very active, very fit. He's a total stud, so we're going to use the most minimally invasive technique possible, the less technique, laser endoscopic spine surgery, and that will allow us to do everything through a little set of poke holes, 2 Band-Aids, and hopefully a rapid return to his wonderful life. So wish me luck. Shot. Shot. Oh, it's already leaking out. Shot. You can see the actual leakage. Exactly the shape of the disc herniation. So cute. There's the disc. The herniation, though, is just underneath here, right there. Oh, I can feel a bump, too. It's pushing the nerve away. There's the exiting nerve root right there. Ooh, look away. It's a Puritan, does not like to be even looked at. Of course, I'm going to look at it at the end, but... Oh, just caressing that thing. Reaching in gently. And right now, just releasing the nerve because it's stuck down. You see that? See how it's stuck? It should be like a foosball table. Everything should be so slick and unattached. But not when there's inflammation. There's the empty tensine right there. Look at that defect right there. That should be solid, a solid wall of crisscrossing collagen fibers, but no! It goes all the way across. That makes sense. Look at that. There. Look at how it's white and then blue. I still love the blue dye. Hardly anyone uses the blue dye anymore. So check this out. That's the extruded disc herniation right there, because look how it's blue way up there. The only way that can happen is that there's a communication between the middle and the outside, and I bet you we're going to find it right here. You have like a little fissure that goes straight up. I wouldn't be surprised if something comes flying out of here. I may have to give it a little push though, like a pimple popper. Look how awesome the laser is. It's so gentle, so precise. Otherwise, I'd have to take a mechanical instrument and scrape that. Let's see if this piece is going to want to come out on its own, or is it going to be like my punk teenage kids? Oh, look at that. Oh, can you hold that scope? The cannula, yep. Because it will not fit down the channel. La 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 la. It's baby Andre. That's not even close to being the biggest disc herniation we've taken out this year, but it's respectable. Respect, as they say. Now remove all the loose pieces. There's a lot, it looks like. I'm almost at the midline now. Look at that thing bulging out. That fat is what surrounds all the nerves. Look, it's bulging out now and it's pulsating. I feel so good. You better feel so good. Oh, I'm feeling good. So I got everything. That was the cavity where the disc protrusion was. Got all the loose pieces. Look at this. It was an empty cavity of pathetic disc. Fine balance between taking enough disc out to avoid a recurrent disc herniation and not so much that it leads to degenerative disc disease, accelerated degenerative disc disease. You already have it. Now I need to examine the exiting nerve root. Save that for last because remember, Puritan. And there it is. Look at how scary that is. Look at how red it is. And look at how red it is right where the disc protrusions were compared to the rest of it. Look at that. It's like a red patch. I don't know if you can see that on camera, but. This disc is really degenerated. Look at that, those bone spurs sticking out the back. Shot. So we'll get that with the endosonic. There it is, entry point into the promised land. That's the canal right there. There's a bone spur right here. There's a huge bone spur over there. This is the disc protrusion, but I think it's mostly bone spur. Look how red everything is. It looks pissed. That little mound of bone, the exiting nerve is right there. So we're going to flatten that out. You can either use mechanical, and then it stops right there, or the most awesome new instrument called endosonic. That's actually moving, but it's just oscillating back and forth like a cast saw. But it's based on technology called the sonicator. It's just vibrating microscopically back and forth really, really fast. Oh, feeling good. I got that bone spur. No more massive bump. And as soon as I did that, it started bleeding like stink because there's no more compression on things. Look how red that nerve was. I'm glad we did 2-3 as well. Like a long time. Yep. We're expecting great things. Surgery's all done. It was boring, if there's such a thing. That's good. That means it was straightforward. I found a lot of great stuff. And the neuromonitoring signals improved significantly before and after. And at 4 or 5, look at that. That's not even all the pieces. Those are the ones that I just recovered. But it's like it's like that hairball that clogs up your shower sink that you reach down and pull it out. It was so gross, but yet so satisfying. So we're all expecting a great result, and we're praying for a speedy recovery, so best wishes.